All right, and next up, we have the 2024 Safety Fair winner. I'm pleased to introduce Donna Mendonça, Dr. Mendonça, DNP, Telemedicine Follow-Up, utilizing a diabetes checklist for adult patients with type 2 diabetes. And thank you so much, Doctor.
Thank you, Dr. Shea, thank you. Good afternoon, everybody. I'll first like to thank Linda Cohen. She has been my inspiration for my passion for diabetes since starting here at SUNY Downstate as an RN in 2002. Not afraid to say 2002. Yes, yes, yes. 22 years I've been at SUNY Downstate and plan to stay many more. I would also like to thank Dr. Arikian. She has been part of my journey when I did my CNS degree in 2012, when I went back to do my FNP in 2014, and my doctorate in 2023. So I just want to say thank you, ladies. Let me start off by saying I am passionate about diabetes. Diabetes is very rampant in this community, East Flatbush. And the reason why I chose to do this project as my thesis is because my first position as a nurse practitioner was for the Transitional Care Clinic, which is a post-discharge clinic. And one of the two major diseases that patients were readmitted for, one was diabetes and CHF. So I experienced these patients and the struggles that we had treating them in regards to their diabetes post-discharge. So this was my passion to choose the topic of diabetes. So defining the project, the problem is that diabetes, of course, is a chronic disease affecting millions of people globally. All right? The management requires adequate treatment and ongoing care. And I'm talking about ongoing care, because these patients, they will yes you, and they really don't understand the complexity of their disease process, okay? So the management of diabetes is adequate treatment, ongoing care, but most importantly, after discharge, these patients are faced with fragmented care because they are unable to get their timely follow-up visits with primary care or the endocrine clinic post-discharge. So this is where the transitional care clinic comes in key, okay? We connect to these patients within 24 to 48 hours after discharge and just, finding out how they're doing, and so on and so forth. So the project's objective was to assess a diabetes discharge checklist, of which I created, which may be utilized during a telemedicine follow-up post-discharge, specifically with adult patients with type 2 diabetes, because I had to narrow the project down. So the intervention included the distribution of a survey to assess the feasibility of the post-discharge diabetes checklist for telemedicine follow-up. Okay, and in the examine, this was a project, a quality improvement project that used a non-experimental descriptive design. A discharge checklist was created specifically for adult patients with type 2 diabetes, and assessed by the providers who generally care for these patients with diabetes. And this was used via a Qualtrics survey. An example of the questions in the diabetes checklist tool were, did you pick up your prescriptions from the pharmacy after your discharge? Do you know how to use your medications? Do you know how to identify signs and symptoms of low blood sugar? Do you know how to treat your low blood sugar? Those kind of questions which you would generally ask a patient after discharge. The analysis included the project's plan, which was the diabetes checklist tool, which was developed from questions and concerns endorsed by patients previously discharged with type 2 diabetes. So I formulated these questions more or less from the concerns that the patients would express to me when I would speak to them 24 to 48 hours after discharge. And then within that checklist tool and the survey, the medical providers reviewed the tool as well as answered these survey questions and gave feedback. Some of the survey questions were, how necessary is a telemedicine phone call follow-up after discharge with your patients with diabetes? How likely are you to use this diabetes checklist tool? And how long do you anticipate the tool would take to complete with adult patients 18 to 74? And how helpful do you think this tool would be with a telemedicine phone call follow-up? So the checklist was distributed June 12th, redistributed on July 5th, and closed on July 21st, 2023. It was a short span because, like I said, it was during my doctorate. A descriptive statistical analysis was used to analyze the responses. The response rate was very shocking. It was 52%. I had 50 participants and 26 responded. So I was quite happy with that. Of 50%, the providers were 40 in internal medicine and 10 were fellows in endocrinology. Most of the participants responded that the telemedicine phone call follow-up was extremely important. 50% of the participants responded that they would most likely use the checklist, and most found that the diabetes checklist tool would be extremely helpful. Now, the change and improvement plan. Noting that the feedback and comments appraising the checklist mentioned that the tool was well summarized, it was applicable to practice, and a helpful guide for most of the important follow-up questions for discharged adult patients. My transformation, the implementation of improvements, was noting that maybe I would have to go with a bigger sample because the limitations were that the sample size was small, and I was, it was due to time constraints that I really didn't get to dive deeply into this. So the future direction was that, promotion of timely access to care and management with the implementation of this checklist tool into the Downstate EMR for use with adult patients with type 2 diabetes. I would get that implemented into the EMR. And I actually spoke to Dr. Mauro Salafu, who's the medical director of medicine, and he asked for me to have a meeting with him so that we can discuss probably getting this into the EMR system to use as a checklist. The goal would be to reduce emergency room utilization and hospital readmissions, because a lot of the times the patients after discharge go back into the emergency room asking for a prescription which was already sent to the pharmacy, but they weren't aware of that. So that's where that 24 to 48 hours connect. Telephone follow-up phone call will let them know prescriptions were sent, do you know how to use it, so on and so forth. Also, reinforcing adherence to the discharge care plan and providing medication reconciliation would also be helpful with this telemedicine phone call follow-up. And identifying any barriers to maintaining and improving the health of adult patients. So in conclusion, a standardized checklist may ease the transition from hospital to outpatient follow-up for discharged adult patients with type 2 diabetes. And the current literature, hence Singh and colleagues, describes how telemedicine follow-up enhances adherence to the discharge regimens and encourages optimal care from healthcare providers. So at this time, I'd like to take any questions that you may have.
I knew we were going to have one over here.
So I remember when I was working in the hospital that every Monday I would get messages on my machine with patients who were discharged on Friday and saying, I don't have my prescription for syringes or pen needles.
Yes.
So what you're doing is very timely. And I would encourage you to really share this with, national organizations, the diabetes organizations, because we come from a unique population, and the return to emergency room rate is so high among people with diabetes. So I would encourage you to share this, publishing or presenting nationally.
Thank you. Yes. Yes. And the good thing is that the ADA guidelines for 2025 does recognize telemedicine as an important factor in connecting with patients, helping with diabetes education and management. And even now with the new use of the CGMs, these continuous glucose monitoring systems, you can speak to the patients during a telemedicine visit, see how they're doing, connect to your EMR through the Libre View system and see how they're doing from your office. So it's really good tools that we have. And I was going to try and go through the research, but I had surgery like right after, so I was out for a few months. But I am going full speed ahead, and I will be calling you.
Dr. Mendonça, thank you for your presentation. I know one of the barriers for continuing care for patients taking their meds is that they don't pick them up from the pharmacy. But I don't know if you're still seeing those patients or you're continuing to see our diabetic patients, but we do have meds to bed for our patients now. So I would encourage you or encourage your patients to opt in for that when they are in the hospital, so they have the medications before they actually leave to go home.
Yes, nice, yes. And even though I was part of the transitional care clinic, the residents in primary care have continued that clinic, the transitional care clinic. So I will be speaking to them also about that. So it wasn't that I abandoned that clinic. I am now actually working in an extension of the endocrine clinic in the diabetes clinic. So I'm seeing the patients after they've had their follow-up visit with primary care, and they come to me for management and education. So we're getting them. But what that was bed for bed you mentioned? Meds for bed. Okay.
Okay. I just wanted to say that I just started with the Freestyle Libre, and what you're talking about would be very helpful, especially to me, because I had a lot of questions.
Okay.
Concerning that, and it was like kind of frightening in a way, because I was for many, many years doing finger sticks. Okay, so when you go from one thing to the next and you really don't have any way of communicating with how do you use this, how does it go about, I think your research is really worth continuing, and I would be really interested in finding out more about this.
Yes, well, listen, please feel free to come by Suite C. I'm there Monday through Thursday. Also, on your Libre, there's a QR scan that you can scan, and it links you to staff who go through the sensors with you, how to use it, and if you have any questions. But it's a wonderful tool, because sometimes patients are reluctant to do their finger sticks because the technique and the pain. Having this sensor on for 15 days now, because the Dexcom and the Libre you can wear for 15 days, it's perfect for them because now they know their real-time glucose levels and they're not afraid to do their finger sticks. So studies have shown that people meet their A1C goals quicker by having these sensors. So feel free to stop by. Okay?
All right, you got one more question. Great job.
So, hi, great presentation, great stuff. I know Linda's fabulous.
Yeah.
So, one of the things that was mentioned was that many of these patients continue to come back to the ED. So now we're screening all of our patients for social determinants of health. Do we ever consider sending home care nurses to these patients' home when we see that, yes, they come back once, twice, 3 times?
Absolutely. When I was the nurse practitioner for the transitional care clinic, that was a big part of my job, finding out the reason for the readmission and why they would come back. And a lot of the times it would be that I need help with my medications. I don't know how to do it. I live alone, so on and so forth. So I was happy to work with the social worker that was in Suite R at the time, and we worked as a team to get help for the patients, whether it be VNS, nurse coming to the home to help with the medication administration, or just the patients being connected to some kind of facility where they would have that access. So it's a big melting pot in regards to that discharge process, and just not saying, bye-bye, there you are.
Thank you.
You're welcome.
All right, big round of applause. Thank you, Dr. Mendonça. Excellent.